Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today's Wednesday, September 22nd, giving you the update from Albany Med. And it's a special day.
It is a special day. We'll get there.
We'll talk about that in a second.
Yes.
Let's pop open the graph. New York State, people in the hospital with COVID, that number is 2,402. I think we can all agree that that graph looks like it's flat or plateaued. Next graph is the capital region. Fred, that number is 164. 2 weeks ago, we looked at that. It was about 150. So it's going up maybe about one per day over the last couple weeks.
A little bit.
I don't want to do another graph a second. I want to talk about another data point. Then we'll pop open another graph. Fred, one of the metrics that's used with COVID is percent positives.
That's right, Dennis.
And we talked about that a lot. So in the capital region right now, the 7-day rolling average is 4%. However, we heard some data recently that in the northern counties, so even above Warren and Washington, we're talking about like Essex and Hamilton, it's 6.4%.
That's right, Dennis. And the corollary of that is their hospitalization rate has gone up over the last week as well.
And it should be pointed out, when you look at vaccine acceptance in the northern counties, it is lower than the rest of the state.
That's right.
So there's probably a correlation there. Next graph here, admissions and discharges here in the medical center. Fred, you can see we had one day recently where we had 11 in one day. So there are days where we have 2 or 3. There are some days where we have double digits.
And we seem to be hovering still, though, Dennis, in that 35 to 40 range.
That's right.
Last week.
So let's pop open that last graph. This is the morning census here at the medical center. We currently have 38, like Fred said. We have 31 on the floor, 7 in the ICU, 4 on ventilators. Let's break that down a little bit more. We have 4 children in the hospital, but thankfully none in the ICU and none on ventilators, obviously.
That's right.
And then in the last 7 days, we've had 28 admissions for COVID and 24 discharges. Fred, of the 28 who got admitted, 89% of those, no vaccine.
Right.
And all the people who are either in the ICU or are on a ventilator, no vaccine. So important.
One other thing I would point out about those 28, Dennis, a fair number of them were children. The children are coming in and going out relatively quickly, but a fairly significant number of that 28 were children.
So for the capital region, currently we have hit a milestone that we're very proud of. The capital region vaccine network set as a goal getting 80% of the eligible population vaccinated, and just today we can announce that 80% of those 18 or older have received at least one dose of vaccine.
Tremendous.
That's 746,000 people. And Fred, we're still vaccinating between 5,000 and 6,000 people a week in the capital region. So work still continues there.
We're making progress.
Booster, any update on boosters?
So on Friday, the FDA panel met. And actually, Dennis, I listened to the conversation. I happened to be in my car and I live streamed it. A very thoughtful conversation by the experts. They did not think that the evidence yet supported boosters for everyone.
For everybody.
It was quite clear in the conversation that we're ultimately going to get there.
Right.
But they thought right now the evidence supported boosters for those over the age of 65 or those at very high risk for severe illness.
Okay.
They talked a lot about healthcare workers, and there was a lot of support for healthcare workers to be in that group.
Okay.
Today, the ACIP, which is a subgroup of the CDC, is meeting right now to further flesh that out, and we'll probably hear at the end of the day tomorrow their decision.
Okay, very good. Right here on the medical center's campus today, very proudly, I think Fred and I can say very proudly, 97.5% of our workforce is vaccinated, which is fantastic. Fred, we know the deadline for the vaccine is next week.
That's right.
We're still encouraging those remaining 2.5% to get vaccinated, and conversations are continuing.
That's right. There are pop-up clinics around the region where they can go and get their vaccine. I urge you, please do that. It's in your best interest, your family's best interest, and the whole community's best interest.
You know, the reality, Fred, is it's been a national news story that there are staffing crises everywhere. There are staffing issues in the healthcare area and in the non-healthcare area. Certainly in healthcare, we're talking about that as well. We really need everybody, right? So if you're one of the unvaccinated, I would make a personal appeal to you. We need you. We need you at the bedside. We need you helping out with all the other essential jobs in the hospital, in the medical center. We'd like every one of those remaining people to get vaccinated because we need you all. All right, we mentioned it was a special day here. So today was the day where we awarded the Albany Prize For those that don't know that, it's been going back 20 years through a very generous gift of $50 million by Morris Silverman. There's an annual prize called the Albany Prize, which is given to scientists in the area of medicine and biomedical research.
That's right.
And the reality is that today we awarded this to 3 incredible scientists. And Fred, who are they?
So let's pop up their pictures. Up there are Bernie Graham, MD, who is the former Deputy Director of the Vaccine Research Center and Chief of the Viral Pathogenesis Laboratory at the NIH. Caitlin Carrico, PhD, as Senior Vice President for RNA Protein Replacement Therapies at Biotech and an Adjunct Professor of Neurosurgery at the Perelman School of Medicine, University of Pennsylvania. And Drew Weissman, her collaborator, an MD, PhD, the Roberts Family Professor of Vaccine Research at the Perelman School of Medicine at the University of Pennsylvania.
So 3 brilliant luminaries, brilliant scientists. We had the great pleasure of meeting them personally.
Yes.
I think to an individual, they're spectacular careers. Why were they given the Albany Prize? Because these 3 individuals, more than anybody else, were responsible for the development of the COVID vaccine.
That's right.
And a couple of them worked on what's called the mRNA delivery system for the vaccine. Fred, let's talk about this. We had the advantage of sitting there, listening to them.
Yes.
People have heard about mRNA. They may even have done their own research, but they were telling us today about this. Let's take their brilliant minds and sort of break it down. What is mRNA?
So mRNA, Dennis, is messenger RNA. And in the body, it's how the genetic code is translated into proteins. So it's an intermediary. So these scientists have figured out a way to use it to deliver it into the body to create proteins that are part of the virus.
Looks like the spike protein.
The spike protein, exactly, so that the body can then develop immunity to it.
Okay, so one of the questions people ask is, if they get injected with one of the mRNA vaccines,
Right.
will it alter their DNA? And what is the answer?
It can't. So the mRNA goes into the plasma. That's the only place it goes within the cells. DNA is in the nucleus. And so the two never cross paths.
Incredible. And what happens to the RNA after it makes the proteins?
So it makes the proteins, it lasts in the cell for a few days and then is degraded like normal messenger RNA.
One of the things people say is the vaccine, this mRNA, was developed too quickly, that it was rushed. How long have the scientists who've been working on mRNA been working on it?
So Dennis, the basic work on messenger RNA it has been going on for decades, literally decades. The 2 investigators awarded the Albany Prize today literally started their work in 2002.
Right.
Okay, and there's work before that on messenger RNA. So it's not like this suddenly was developed and put into play in a year.
You said one of them had a quote about...
Well, no. This was my quote that
your
I think
quote.
defines this whole circumstance, and that is "Fortune favors the prepared mind."
Yes.
And that was a quote from
You tell me.
Louis Pasteur.
Yes.
So very appropriate.
Yeah.
So there's all that basic work on messenger RNA, and then the NIH for 5 years has had a consortium of 5 major universities, the NIH and Moderna, working on messenger RNA-based vaccines, and that came out of the original SARS virus from 2002, and then the MERS virus, which I think was 2011, where the NIH started to try to develop vaccines for those viruses. So all of the gears were in place, the machinery, the relationships, everything was all set to go, and then COVID came. It was perfect timing.
And Dr. Graham, who comes from the NIH, who was working on vaccine development for his entire career, he talked, Fred, about adverse reactions. And he talked about how if you're going to have an adverse reaction to a vaccine, you're likely to get it in the first 6 weeks after getting it. And now with hundreds of millions of doses having been delivered, the evidence supports that the vaccines are safe, and he is obviously the content expert there.
Absolutely. He said 99.9%, I think those were his
Right.
words exactly, of reactions occur within the first 6 weeks.
Right. So I think it's remarkable. Congratulations to the people who received that award today. I think it was a great day for Albany Med. Don't be surprised if in a couple of years we see a couple of those people getting a Nobel Prize in medicine.
Yeah, absolutely, Dennis. I think that's in the offing.
Oh, and one more thing, the mRNA, they're talking about that potentially being used with other disease treatments in the future, not just with vaccines.
So later this afternoon, or I'm sorry, earlier this afternoon, there was a panel discussion, and they were talking about it for other types of infections, but also as a way of treating cancer.
Right.
Really quite remarkable.
All right, very good. All right, so we hit the important things today. We have an update on COVID. Obviously, we're encouraging the remainder of our workforce who's unvaccinated. Let's get vaccinated. We need you here. We need you taking care of our very important mission. And an amazing day with the Albany Prize.
It really is fantastic.
All right, we're rolling into the weekend. As always, we thank all of you who will be here around the clock, taking care of the patients at the bedside or supporting that admission all through the weekend. And we'll be back again next week.
That's right.
All right, we ask that you once again please take care of yourself, take care of each other, and we'll see you next week.